Hi, this is Angela with Angela's Nurse Toolbox. Let's learn more about the different types of syringes we can draw medicines in and which one is best suited for each. All right, the first syringe we're going to look at is our 1 milliliter syringe. So this syringe, if you look at the markings on the side, okay, there's lots of little bitty lines. This one is 0.9, 0.91, 0.92, 0.93, and the longer one is the halfway mark. So this is 0.95. This one can draw up, if I have a dose, 0.25. This would be the marker, and you can move these to the side right here. Because each one, this one can go up to the nearest hundredth for an accurate dose. So I'm going to show you drawing up 0.25. Okay, so now I'm going to show you 0.25. So here's the 0.2. Each one of these is 1. So 0.21, 2, 3, 4, 5 is the longer number. So I'm going to go ahead and push my little plunger up to get to that number, to that line, slowly. And this is 0.25. It's precise. So if you have a dose to the nearest hundredths, this would be the syringe you would want to choose because you can get to the nearest hundredth. Okay, we don't round and just say, oh yeah, it's going to be 0.3 because that's 0.3. We don't round when we're drawing up in a syringe because then the patient gets too much because that's not what the order wanted. If we do our calculation and it was 0.24, then they need exactly 0.24. Okay, so this is our 1 milliliter syringe. The next syringe we're going to look at is our 3 milliliter syringe. Okay, 3 milliliter cc is the same thing. Okay, we need to look at the markings on this one. So we have a 1, 1.1, 1.2, 1.3, 1.4, 1.5. So this one, if I have a 1.6, I can draw this up. Just trying to see where my finger is on here. 1.6, 1.7, 1.8, 1.9, and 2. So this would be a syringe if I went to the nearest 10th, drawing up to 3 milliliters. And always look at your institution that you're working at, their syringes, because sometimes these numbers might go by 0.2. Okay, but this syringe, actually, every one of them is 0.1. So let me show you 1.6. So if I'm looking at this syringe, okay, here was our 1.1, 2, 3, 4, 0.5, and the next line would be 0.6. We always look at the top of the plunger, black line, to line up for our doses. Now if I was at 1.5, my plunger would be right level with the 1.5. If I was 1.4, I would move it up to the next one. Okay, so that's how this syringe works. Now our last syringe is an orange cap syringe. And it says on the side, U100 insulin only. That's all that should be drawn up in this orange tipped syringe. So if we look at this insulin syringe, I can give up to 100 units, and each of these little lines is one line. Okay, so this is 95, 96, 97, 98, 99, 100. So I can give up to 100 units of insulin. And this does move to the side so you can kind of twirl it around as you are calculating your insulin dosages. Now these lines are very, very, very small Makes it difficult for patients that maybe cannot see very well to draw up the accurate dose. So insulin is a high alert medication. We always have another nurse verify what we drew up, so we have to show them the vial and we show them the syringe so they can make sure we did draw this up correctly. Okay, so it's a high alert medicine. Always have it double checked by another nurse. In most facilities, you have to have that nurse sign off either electronically that she did verify what she drew up. All right, so I'm going to show you what 32 units looks like. Okay, so if we're looking at this syringe, this is our 30 units. Then I need to go to this one, that's 31, and this one is 32. So I need to push my plunger up to get it precisely 32. So as you're doing this one, you're going to kind of turn it from side to side to make sure that you're at the correct dose. So this is 30, 31, and 32 is lined up. So that is our 32 units of insulin. Now remember, when you are selecting your syringes, you're going to do this based on the dose that you've calculated and what medicine you're given. So the doctor's not going to say use a 1 milliliter syringe to draw this up, or a 3 milliliter syringe, or you need to choose the 1 insulin syringe. So we have to use our nursing judgment based on the doses we are drawing up. So if we have doses to the nearest hundredth, we would select this 1 milliliter syringe. Doses up to 3 milliliters, we would select a 3 milliliter syringe. And if we're doing insulin, only the insulin syringe with the orange cap. And remember, this is a high alert medicine. Always have it double checked by another nurse. If you like my videos, go ahead and subscribe. This is Angela's Nurse Toolbox.